the travel season is underway with oil prices being relatively low. This can mean cheaper gas and airline deals, but what you should know about is an unexpected health danger that could turn your vacation into a medical emergency. Deep vein thrombosis, or DVT, occurs when blood clots from the deep veins of the legs after sitting in a confined space or being immobile for a long period of time can occur. Dr. Robert Lookstein, professor of radiology of surgery at Mount Sinai, joins us now to discuss what you need to do about DVT before you set off on your vacation. Good morning. Thank you for joining me.
Good morning. Thank you for having me.
Now, with the travel season being underway, what are the health risks that travelers should know about that aren't often discussed, and how can they know?
So, as you alluded to, long-distance travel has been associated with an increased risk of developing blood clots, or DVT. The so-called economy class syndrome is a syndrome whereby long-distance travelers are immobilized. Typically, they're dehydrated. And unfortunately, once they complete their travel, they find that they have swelling, pain in their leg, achiness, and they're diagnosed with blood clots, or DVT.
Now, what are the complications and symptoms associated with the condition?
There are two complications or side effects that I think all your viewers need to be aware of. The first is when the blood clots break off the veins of the leg and travel upstream in the circulation towards the heart. At that point, they can occlude the circulation to the lungs. This is referred to as a pulmonary embolism, or a PE. This is a very serious medical condition. It frequently requires hospitalization, and in the most severe circumstances can even be life-threatening. The less well understood side effect is a chronic syndrome characterized by leg swelling, pain, difficulty walking, achiness. This is referred to as the post-thrombotic syndrome. It affects the leg where the blood clot's located. Recent evidence suggests that as many as 3/4 of patients diagnosed with a blood clot in the large veins of the thigh or the pelvis can be afflicted by this chronic side effect of blood clots.
Now, what puts someone at higher risk for deep vein thrombosis?
Well, we just alluded to travel, long-distance travel especially, being a risk factor for this. But anything where you're immobilized for long periods of time, so a serious illness where you can't move around, even surgery where you're recuperating, recovering, and you can't get up and walk around. These have been shown to be risk factors for developing blood clots. In addition to this, patients, unfortunately, who are overweight, obesity, this has been shown to be a risk factor for developing blood clots. Smokers are at elevated risk. Patients who are taking medications, especially those that have hormonal effects, these can place you at increased risk for developing blood clots. And then lastly, anybody who has a family history of blood clots, they're at increased risk as well.
Now, tell us, why is early diagnosis so important?
Early diagnosis is critical because now the diagnosis can be made in the office. Anybody who's concerned that they might have a diagnosis of a DVT should contact their doctor. Their doctor will typically draw a simple blood test or perform an ultrasound in the office looking at the veins in their leg. If you are diagnosed with a DVT, typically treatment involves medication, typically blood thinners. Blood thinners have been shown to reduce, if not eliminate, the risk for developing pulmonary embolism. However, despite this, some patients may need to have a minimally invasive procedure to remove the blood clot from the veins in their leg to reduce their risk of developing the post-thrombotic syndrome. Recent medical advances allow this procedure to be performed as an outpatient, so it's available to a broader spectrum of the population.
That's good to know. And what advice do you give travelers this summer about this condition?
So I think most importantly, as it's getting warmer and warmer outside, it's important to stay active. If you are planning long-distance travel, it's important to get up and move around as much as possible. If you're on a long-distance flight, get up, walk up and down the aisles at regularly scheduled intervals. If you're in a car, pull up along the side of the road, pull over into a gas station, stretch your legs, walk around. Avoid caffeinated beverages, obviously avoid alcohol, stay hydrated. These are all ways that you can personally reduce your risk for developing blood clots. If your viewers would like more information about this topic, a recent website that was developed by Boston Scientific is clearingtheclot.com. This is a fantastic resource that reviews patients' risk factors for developing blood clots and gives the latest recommendations about how you can reduce your risk factors.
Great, thank you so much. And for more information on deep vein thrombosis and how to keep your state safe this summer during travel, visit www.clearingtheclot.com. Thank you so much. It's been a pleasure.
Thank you for having me.
Have a great day.
Great day.